Good morning and welcome to the Brattleboro Citizens Breakfast.
Good morning.
You may have been following some of the news during this. It's a political season, right? There's an election coming up on November 4th. Remember to vote, right? November 4th. If you haven't voted already. But some of the news recently has been about single payer being a hot ticket item in the election. And there's been some editorial comment about Medicare and single payer. That will single payer affect Medicare? Will it affect the funding? Because the state needs to get a waiver from the feds, will this affect Medicare in some way? And some people have been, or it's been out there sort of as a, I guess I'd say a fear tactic in a way, of saying, well, you know, maybe single payer is not a good idea if it's going to affect adversely Medicare. So that's one of the myths, I think, in my opinion, that's going around. I hope we can get some clarity around that. And there's a lot of other stuff going on in terms of Medicare fraud. And so this is an opportunity to get some facts. We're going to talk to Kelly McElheny, okay, from C.O.V.E, the Council on Vermont Elders. And she'll tell us about Medicare facts and fraud.
Thank you, Bob. Good morning, everyone. I'm Kelly McElheny, and I am your Southern Regional Coordinator for the Community of Vermont Elders Senior Medicare Patrol Program. And the SMP program is in all 50 states and 4 territories across the country. And our goal is to empower you guys as beneficiaries of Medicare to protect yourselves from being the victim of fraud, error, or abuse when it comes to your Medicare. So a little bit about the SMP program. We have been in existence here in Vermont since 2003. The Community of Vermont Elders houses us, or is what we call our sponsor agency. So they take our federal grant that we receive from the government and they administer it for us. And there are 2 of us who currently cover the state. Anita Hoy is the state director. She's located in Montpelier, and I am down here in the south. And we've kind of taken Route 4 and split the state. So she goes White River Junction north and I go White River Junction south. So anywhere between White River Junction, Rutland, Bennington, and Brattleboro, you will generally see me presenting or hear of our volunteers within the southern region doing the presenting letter. And we work very closely with the Federal Trade Commission and AARP and the Department of Financial Regulation. But most importantly is the packet in front of you on your table. I've put, I believe, 7 of them out at each table. So if you don't have one, please let me know. I'll be sure to get you some. This is our general, what we call dissemination packet. And this includes most of the information that would be relevant to you if you are a caregiver, if you are a beneficiary, or if you are a service agency, in terms of information to pass along to beneficiaries. And when I say beneficiaries, I'm including both senior citizens as well as individuals who are below the age of 65 and on Medicare. That is a new target population for us. Is what we call the dual eligibles, so they are both below 65 as well as on disability or for some other reason qualified for Medicare. And this information is relevant to all people who receive Medicare. SMP is very interested in developing their brand nationally, and they changed a few years ago from the Senior Medicare Patrol to just SMP. So if you hear just SMP, it gets very confusing for some people because they're like, what does SMP mean? So it generally means Senior Medicare Patrol. And this is our brochure that's used nationally. And they would really like us to have this brochure be visible, recognizable, and readily available for beneficiaries to have for reference material. On the back of this brochure is our state contact information. And that information is very important to you Because if you receive a telemarketing call, any kind of a third-party mail solicitation, an email solicitation, knock on your door, anything of that nature, you need to give us a call immediately, because there are some rules and regulations within the state of Vermont how health insurance companies and other Medicare benefit providers can directly solicit you in order to sell you supplemental plans, Part D plans, Advantage plans, anything of that nature. So what we like to recommend is that you keep this brochure on your refrigerator or next to your phone, and even if it is a very innocent, benign phone call that you receive, that you hang up on, that you do not even communicate with, we want to know that these telemarketing scams or mail scams or direct home solicitation is going on, because we can track it. And we also work very closely with the Consumer Assistance Program through the University of Vermont, which is called the C.O.V.E program here, and it is set up by the University of Vermont as well as the Attorney General's office. And any fraud, scam of that nature, lotto, groceries, anything of that nature, we may not be able to help you with in terms of Medicare, but the C.O.V.E program can. And they want to know specifically the scams that are going on within the state so that they can send out consumer fraud alerts. And they do that both to law enforcement agencies, service providers, just as well as any group that might work with a beneficiary or a senior that needs to be alerted that this is going on. So if we can't help you, the C.O.V.E program can help you. And between the two of us, we generally have a direct referral process that goes on that we can get you directly to the Attorney General's office and have the issue resolved for you. Now, sometimes issues of scam, error, fraud, and abuse cannot be resolved, particularly if it involves wire fraud. Once that transaction occurs at the other end, so in the instance of the grandparent scam that we see here in Vermont, an individual will call you and say, "Hi Grandma, it's Kelly, I'm stuck in Canada, could you wire me $6,000 so I could get home?" Well, I know many of us say I would never be taken by that, but in actuality, one of our state senators actually was taken for about $6,000 in that scam because he was preyed on of the innocence of his grandchildren, and he truly believed that his grandson was stuck in Canada and that he needed to get home. So he wired that $6,000, and as soon as that transaction occurred at the other end, meaning the person had the security code, they went and picked up the money, and everything was done, there is no way that we can get your money back. But in the meantime, before that transaction completes itself, we are able to stop those with fraud alerts, and the C.O.V.E program actually works directly with Western Union to stop many of those wire transfers from occurring, particularly when they see it's a vulnerable individual and it's a large sum of money. And the clerks who work at these Western Union stations have actually been trained in anti-fraud to make sure that they stop it before it completes itself. So just to give you a little bit of background on how the process works. So if you call us with a Medicare-related issue, we have got 2 lines of referral for you. We can go directly to the to the Attorney General's office, or we can start an investigation or a complex referral that we call it, and we can begin to see where something may have gone wrong, what may be going on, whether it is error, abuse, or fraud. And then we can make referrals from there. We also have a direct link to the Office of the Inspector General, which is very important to our program because that starts the ball rolling with the FBI. And once that ball starts rolling, it is completely out of our hands and it becomes a federal investigation. And SMP has resulted in many federal investigations shutting scam artists down. In particular is the scooter store in Florida. Not sure how many of you have ever heard of the scooter store or heard the story about the scooter store. Upwards of $50 million a year they were scamming Medicare out of. And what they were doing was submitting claims for scooters, claiming that they are free to beneficiaries, but when you have to give your Medicare number for something that may be free, Medicare is billed. And when it comes to something like a scooter, which is durable medical equipment, that's going to be your 20% under Part B. So little did many beneficiaries know that they would soon receive a bill for upwards of $10,000 owed on their scooter. And then what would happen is they would take their scooter outside, because that's why we get scooters, so that we can be mobile outside and go long distances. And once it was taken outside, the warranty was null and void. So you could not get your scooter fixed. So $50,000 on a scooter, $10,000 to you, $40,000 to Medicare. Then you can't get it fixed, and now you have this scooter that you can't do anything about. So SMP program actually was one of the first catalysts to start OIG looking into this, and the FBI went in and shut them down a year ago. Unfortunately, they've figured out a way to rear their ugly heads back up, and they're back in business, and now they're renting scooters to the price of $150,000. So, as the scam artists get better, we have to step up our game also and figure out where it is that they are still continuing to scam. So, a little bit of background on the Community of Vermont Elders for those of you who do not know who we are. The Community of Vermont Elders is your legislative agency in Montpelier. You are able to become a member or just receive updates from them if you are interested, or even participate if you are interested. But the Community of Vermont Elders is a very important group for those of you interested in legislative issues. Of particular importance this year is LIHEAP. They've increased some funding for low-income heating assistance programs. So that was really good news. Transportation is a major issue for C.O.V.E. this year. We did just see a disbursement of, I believe it was $600,000 was just disseminated across the state for what is called E&D funding for transportation, and that is the elderly and disabled funding. And that is your trip to the grocery store once a month, or to get your hair cut, doctor's appointments, things of that nature. Some of the free buses that the current offers, or the Uber offers. So we're trying to get some more funding for transportation issues here in the state. Also of importance of what C.O.V.E. is doing is kinship. For many of you who may be taking care of your grandchildren and did not have as many guardianship privileges as a parent would, we're trying to change that, to make sure that some kinship legislation gets passed, to help you guys have more of a say in the raising of your grandchildren. We always include some tips to keep you protected in the packet of information that we hand out. Always remember, protect your Medicare number as it is your Social Security number. So anyone gets a hold of your Medicare number, they're going to have your Social Security number, and then they can ultimately wipe you out. So be very, very careful about making sure that if someone calls you, you don't give that number over the phone unless you know who they are. You don't put it down on forms unless it's going to a direct service provider. You just don't offer it up as information that someone could use to identify you unless you are absolutely sure who that individual is. Also, prescription drugs. We just had a take-back day in September. I believe it was the 27th or 26th. Many areas across the state are now having 24-hour receptacle drop-off sites. So you may just go in and drop your unused or unwanted prescriptions right in those receptacles, no questions asked, if you fear that they may land in the wrong hands. I don't know if many of you have seen the Brattleboro Coalition posters around, but it was very impactful to me in terms of one of them stating that your child's first experience with drugs is from grandma's medicine cabinet. And it's very true. What we are seeing with a training that we do called When Healing Hands Harm is that even some service providers, home health care providers, who may be afflicted with a drug addiction or a drug problem, some may go into the home, know that you have those drugs, and be taking them from your medicine cabinet while they're setting up your oxygen or setting up your bed for you, or just doing your daily care. So you need to be diligent about making sure that you're staying on top of any unused or unwanted meds that you may have in your medicine cabinet, that you're protecting those, maybe even keeping them in a place that's locked, and then disposing of them when you're done with them. So other tips to keep you protected. One of the big things going on right now, we all know that open enrollment started a week ago, last Wednesday. So now is the time for your Medicare Advantage as well as your Part D changes if you want to make those changes. With Part D, you should have received what's called an advance notice of change last month. This is very important for those of you who are on regular medications because some of the formularies in Part D plans, change yearly. And when you receive that advance notice of changes, you need to look at that list of drugs very carefully to make sure that your medication is still listed as part of your plan. Because if it has been dropped, then you will need to change your Part D plan to make sure that it still covers your med. A caveat to that is that some meds can be dropped within a benefit year with only 10 days notice. So you'll have to be very diligent of reading these advanced changes, and I see some laughs. It is rather ridiculous at times that that's all the notice that they give you, because between the time you receive that notice and the 10 days you have to change it, there's sometimes no way to change those. So yes, and you may be stuck for the rest of the year with out-of-pocket expenses for those meds. And we have an individual in the Bennington region who was dropped halfway through the year from a med that cost $3,000 a month. So you can imagine, we've been fighting for about 2 months now trying to get his meds covered because he has been going without. So it's very, very, very important that those notices of changes be read and be paid attention to. And the SHIP coordinator here in your area is Sharon O'Neill. She's out of Senior Solutions up in Springfield. She's happy to travel wherever you may need to go. I have a few SHIP brochures with me. And she can help you change that Part D plan for you. She may not find you the one that fits exactly. If you're computer savvy, you may also go to Medicare.gov and do the changes yourself. And you can shop and you can compare. And I am going to be doing a presentation next month here, second Wednesday of the month. I believe it is the 8th or the 11th. No, 12th. Thank you. November 12th. I'll be doing my Medicare Minute here during the lunch hour, and that is specifically about open enrollment. So I'm hoping to have my computer with me to show some of you what that looks like in terms of Medicare.gov if you're interested in just doing a walkthrough, if you want to compare those plans yourselves. Okay, so with the open enrollment also is Medicare Advantage, Medicare supplemental plans, your Part D plans. But one of the things that we like to try to make sure you guys know about during this particular time of the year during open enrollment is you're going to be receiving a lot of third-class mail, a lot of solicitation in the mail during these next 3 months. The only way that we can protect you from becoming a victim of scam if you are targeted by these insurance companies is by letting you know that you cannot send back those information cards. They will send you a packet of information with a little tiny postcard in it. It says, I want some more information about this plan or this topic or whatever. You mail that card back, you have invited them into your home and there is nothing that we can do to help you. If you do not directly solicit them asking for more information, it is against Vermont law for them to solicit you directly, by phone, by coming to your house, or by trying to get you through the mail. Another tip that we give is that third-class mail you don't have to take. You can go to your postmaster and say, I don't want any more third-class mail, and you won't get any more junk mail. And it is as simple as that. So if you're interested in having that done, go to your postmaster and let him know. No more junk mail. I don't want any more of it. You might lose out on the Publishers Clearinghouse, but that itself is a scam. So as I said, no direct solicitation. Do not respond to them if they ask you if you want more information. Protect those unused or unwanted prescription drugs. And then there's other tips about, don't let people know that you're away. Make sure somebody's getting your mail. Remember that the scammers, particularly in securities and investment scammers, or other big money lotto scammers, those types of scammers, they already know who you are before they even call you. So they have been researching you, trying to figure out what kind of resources you have available and how they can get a hold of those. So be mindful of that if you are suddenly approached by someone with that magical ticket that's going to make you rich for the rest of your life. If it is too good to be true, it is too good to be true. So, and then of course your Medicare summary notices that come out every 120 days. Those are very, very, very important for you to protect yourselves from any kind of fraudulent billing or Medicare errors that may be occurring. And this is where we get into error, abuse, and fraud. And some people get really squeamish when they see SMP showing up to give presentations, because some of them may think of us as sort of the Medicare police, and we really aren't. We're really just trying to protect seniors, to advocate for themselves and be empowered to protect themselves. One of the things that we see is billing errors, and that is a simple coding error. It can be entered in incorrectly. It could be diagnostically incorrect. There's so many areas of error that it could occur with just a simple ICD-9 number, that it can end up in a cascade of other problems for you. ICD-9 is the medical coding for whatever the diagnostic treatment might be. So they have like a little uniform code that they use. In that, errors will show up on a bill from the hospital, on a bill from a doctor's office. Will show up also on that Medicare summary notice, but sometimes you are going to have that discrepancy. So what we like to suggest is make sure you review that Medicare summary notice for any errors that you might think are occurring there. Compare those to bills and wait to pay that doctor or hospital bill. Because in the next billing cycle, so the next 120 days cycle, that issue may be resolved and may be corrected for, and you may not owe on that bill. And so many of us are so used to paying our bills on time and as soon as they come. This is the one area where it's okay to make sure that you are able to compare those things to each other to make sure there are no mistakes. We see it with billing from hospitals, billing from providers, home health care agencies. A lot of home health care agency errors where billing will continue after services have ceased. So you have to make sure that you're paying attention to that. Also with hospice services. Sometimes we don't know what the services are that beneficiaries may be receiving, and there could be some discrepancy there. So we have this error, no big deal, human error. As long as it gets fixed, we're fine with it. It's when we have to go back that second billing cycle and say, excuse me, but that code is still wrong and you're still charging me for a service that I'm not receiving. That's when we start to wonder, is this abusive? And abuse can be that you didn't change the error, or you didn't upgrade your system to make sure that the errors didn't happen again. And I'm speaking about service providers, not so much individuals. So now we say, well, now you're breaching into the realm of abuse, and we might have to report you to CMS. And once CMS, the Center for Medicaid and Medicare Services, takes over, it's out of our hands, because then you get flagged for potentially being dropped from an assignment, and you no longer are allowed to even take Medicare. So, doesn't get fixed, we see it again in the billing cycle, that becomes abuse. When we start to see it repeating itself in a trend, similar across patients, similar across diagnostic issues, similar across just medical issues in general, that's when we know it's fraud. And I do not have to prove fraud in order to report fraud. So please keep that in mind. If you believe that you are being defrauded, I want to know, because I will send it directly to the OIG, and I don't have to prove it at all. So the burden of proof is not on me. All I have to do is suspect it, similar to my state director, Anita. And right now, I generally refer most of the complex issues up to the state. I'll resolve most of the simple ones down here. But she is very quick, within 24-hour turnaround, and we are very effective in making sure that we get resources returned. So just to keep that in mind for all of you. Thank you. Okay, so SMP is a peer-to-peer education program. So that means it's seniors to seniors educating each other. I generally go around and do major community presentations such as this morning, but most of the time you will see one of my volunteers giving a presentation. I have many that do the Medicare Minute over in Bennington. I have many that do Savvy Seniors presentations up in Springfield, and I have many in Rutland that are doing Medicare Minute up there. So I kind of take Brattleboro, and then my volunteers are spread out across the rest of the state. But we are always looking for volunteers. So if you are interested in writing, if you are interested in articles, or if you're interested in research, if you are interested in direct education or presenting, we have game shows that we have bingo, we have Jeopardy, we have all sorts of activities that you can do if you are interested in volunteering that doesn't require going out into the community and doing anything. It could be phone calls, it could be computer-based work. And I am always happy to have people involved, because the more senior to senior or beneficiary to beneficiary communication that I can get out into the community, the more effective SMP will be. So please feel free to contact me, and I have some business cards with me today if you are interested in volunteering in any capacity. This is a very important sheet that we recently developed over the summer by demand, and we're going to be doing this across the state. It has a little bit of a yellow mark down it. I kind of like it because it does make it a little more, it stands out a little bit more, but it was a copier error on us, so I apologize. But this is our referral sheet, and this tells you when and who to refer to in the instance you think you are being scammed, or you have a friend or a client who may be being scammed. So call us if it's Medicare related, call the CAP program if it's anything else related. Department of Financial Regulation always wants to hear if there's an insurance scam or security scam going on. And of course your local authorities. And do not hesitate to contact your local authorities, because they also want to know if there are scams going on so that they can better protect you guys as well. Programs that we offer are Medicare Bingo, Medicare Jeopardy, When Healing Hands Harm, about prescription drug diversion. We have our new Medicare Minute, which is a 10 to 15 minute presentation on updates, changes, and tips on how to protect yourself. And I give that here in Brattleboro, second Wednesday, Castleton second Tuesday, Bennington second Friday, and I'm working on getting a Springfield site. And I'm also working on pushing out to the CARES communities, so Putney Cares, Westminster Cares, Marlborough Cares, Halifax, all of those groups as well. Hopefully you'll be hearing from me within the next month, because that's sort of our next initiative. And then I've been working with these SHIP coordinators for the last 3 months, developing a standardized training for new to Medicare. So just for those of you who are interested, new to Medicare books are coming out right now. I did not bring any with me today, but I can bring some on the 12th when I'm back here, or I can send you one directly if you are interested. But this has everything you would need to know about new to Medicare. Of particular importance, so that you all know of it, is page 61 of your 2015 book, is the 23 free preventative services that Medicare offers you. These are at no cost. This includes a physical. And I know that there is some confusion out there about what is the definition of a physical. But what they call it is a wellness visit. You get your welcome to Medicare, and then you get a yearly wellness visit. That yearly wellness visit is free, and within that yearly wellness visit, you can have your diagnostic work done that would be required for a physical. And most of those services will be paid, with the exception of that 20%. But if you have the supplemental program, then that will be covered through your supplemental insurance. Also, for those of you who might be on an Advantage plan, we have some bad news actually. AARP dropped 2 Advantage plans this year. So people who may have had an Advantage plan with AARP as part of a pension may find themselves needing to get a new one. Page 148 of the new to Medicare book is the Advantage plans that are left. There's only 2. So, and as the Affordable Care Act said, they are going to be dwindling those down more and more because of the subsidies that are being offered on some of those plans. So we do have a lot of beneficiaries who are very upset about that, and hopefully we will have some more information coming out in the next year as to what's going to replace that. Okay, so Ombudsman, just so that all of you know, is now healthcare advocates. They are the people that you call if you do have a health insurance related issue, if you cannot get it resolved from SHIP. Advanced directives, I've had a lot of questions about advanced directives in the last few months and filling them out. We do not offer advanced directive services, although I'm happy to meet one-to-one with you to go through the advanced directive and talk to you a little bit about it. But for the most part, call Vermont Legal Aid. They have a project going on that is directly related to helping you get your advanced directive filled out, registered, and submitted to the state, and then you can just do the updates through them. And then lastly is just community collaboration. One of the initiatives I've been working on for about 4 months now is trying to get involved with time banks throughout the state. And I'm working with White River Junction, Bennington, and I've been in communication with KIP here and some of the crew here in Brattleboro. And we've developed a time bank skit. We have a program called Savvy Seniors that goes around the state, does some quick presentations. And one of our skits now is about the time bank, because we really want seniors to start to use the time bank as a resource of barter and trade, as it is intended to be. So I'd be happy to speak with any of you about further community collaboration with other organizations. We're happy to always make skits pertaining to any real life topic that might be affecting seniors within the region. But I'm also always happy to just come and present to groups, no matter the size, to disseminate this information and make sure that everyone gets the right message. Does open enrollment happen yearly? And yes, we have 2 periods of time. October 15th to December 7th is when Part D and Medicare Advantage plan open enrollment occurs. So during that period of time, you can change your prescription plan and you can either unenroll or enroll in an Advantage plan. Then we
short explanation of when you don't sign up for that originally.
Okay.
Or I can ask you later if you think it's not
Yeah.
of interest.
We've also have general enrollment in the spring, which is basically just an open period when you can also enroll in some of these programs, but that's mainly also for supplementals. So the second question asked was, what happens during that time if you did not enroll? Okay, so Part A is your hospital insurance, and you are automatically enrolled in your hospital insurance when you go on Social Security at 65. So that's taken care of. Part B, you have to subscribe to individually, or you may not subscribe to individually, and that will cost you a 10% penalty retroactively to your 65th birthday if you did not sign up for that. And Part B is your provider insurance, and that is your doctors your outpatient services, home health care agencies, therapy services of any kind. So if you do not sign up at 65 for Part B, you are going to have to pay a 10% penalty retroactive for the amount of time since you turned 65.
10% of what?
Your Social Security benefit. Yes, there is a very severe penalty for not taking Part B. Then you also have the same type of penalty for not taking Part D, your prescription plan. So if you do not take your prescription plan, once you enroll, you will have to pay that penalty. Same thing goes for Part B. You only pay that penalty once you enroll. So if you have TRICARE, or if you have VETS VA, you don't ever need to enroll in a Part B. You keep your Part A, VETS takes care of everything else for you. But for those of you who didn't sign up at 65 for Part B, and you decide at 68 you want to sign up, you're going to end up paying a 30% penalty. So if you have been part of a prescription plan as part of a pension, and they drop it, and then you need to enroll in a Part B or a Part D, you will not be penalized because you were enrolled in that type of a program. Yes, sorry. It does get a little bit nerve-wracking sometimes.
Well, we have no, there are staff unions, and those of us in the retirement organization have no recourse, no defense. We have an organization, but they just say, yeah, you don't even have a representative on the retirement board. So we are always very, concerned. We have a very vocal group because we're management and all levels of staff, and very savvy group, but that doesn't mean they won't just.
So now we have a whole slew of GE retirees over in the Bennington, Rutland area who have no health insurance anymore. So this is happening and this is real. And SHIP is here to protect you guys. SMP is here to make sure that you aren't victims of fraud. But what do we do once we've relied on these pension plans for free for so long? What do we do when they are dropped? And that is a trend. And that is coming up, I believe, in ACA in the next year. SHIP is working to advocate for that. I know that C.O.V.E. is also working to advocate for that. So you do have a lot of people on your side. It's a bureaucracy within a bureaucracy, so it's going to be tough to weed our way through it. What does SHIP stand for? SHIP is the acronym for State Health Insurance Program. And it is run out of what is called the AAAs, or the Councils on Aging in the state. And your Council on Aging for you here in the Brattleboro region is Senior Solutions, and they are out of Springfield. And your SHIP coordinator's name is Sharon O'Neill. If you are in Wilmington, then your coordinator is going to be Sandy Bartlett, and she is with the Southwest Council on Aging out of Bennington, Rutland. Question was, how many scam operations do we see in here? Fraud costs Medicare $90 billion a year. A year. That is not a lifetime, that is a year. So of the $860 billion that the federal government spends on Medicare per year, it's like $525 to $860, $90 billion with a B. It's amazing, it's such a big number, I don't even think I can put that many zeros at the end of it. $90 billion a year is lost to fraud, error, waste, and abuse. And that cost is passed on to you in the forms of higher premiums, higher health care costs, higher prescription drug benefit costs. So it is really beneficial to you to be saying, no more fraud, no more error, stop scamming me. And remember, as I have said, you are our vulnerable people. They already know who you are before they even call you. So be very, very aware of that.
My experience here today is that everything has become even more complicated, has become even more frightening, and I'm kind of disheartened that somebody like yourself tells us how much concern you have, would go through this whole lecture and not talk about the possibility of universal single-payer health care in Vermont, which would probably eliminate almost all of these problems.
The New to Medicare book is huge. The Humana book is huge. Lot of information to read. Not really sure much of what it is that I'm reading, if any of it is relevant. The SMP is coming here to speak with you today about protecting yourself from Medicare fraud, error, and abuse. Yet we are not talking about single-payer healthcare. Okay, here is my short answer to that. There's a much longer explanation. I am part of a group that advocates at the state level for your rights as senior citizens and Medicare beneficiaries. However, I, as an SMP, volunteer coordinator and outreach coordinator, am banned from lobbying of any sort. So I politically cannot get involved at all with single-payer issue. That is against the federal law when it comes to having a federally funded grant. We cannot do lobbying. C.O.V.E has a separate group of policy committees. They did have a lobbyist. I'm not sure if we continue to have some of the work of that lobbyist. They do their advocacy and legislative work separately from what I do as an SMP coordinator, which is Medicare fraud, error, and abuse education. I do not do any kind of lobbying at the state level. What I will tell you on the single-payer issue is that the fraud when it comes to Medicare is going to be very difficult to combat under single-payer. Single-payer is merely going to change who administers the money. The benefits are not going to change. What you get under Medicare, you will still get under a single-payer health insurance program. It's just going to be a matter of who pays for it. So does the state pay for it first and the federal government reimburses them? Or do you pay for it, state reimburses you, and then the federal government reimburses them? It's going to be just a matter of shuffling around who actually holds the pot of money. The benefits themselves are not going to change. You're not going to lose your 23 preventive services. You're not going to lose your annual wellness checkup. You're not going to lose your 20/80 split on your Part B. You're not going to lose any of your deductibles or your copays when it comes to your Part A and what that covers for hospitalization. None of what you get through Medicare is going to change. It's just going to be a matter of how it's paid for that will change when it comes to single payer. Now, the criticism of single payer is that with TRICARE, with Medicare, and with Green Mountain Board, you're not going to have essentially a single payer system. You're going to have three. TRICARE is military, Medicare is government, Medicaid also, and then your regular state health insurance, Green Mountain Care, or what used to be called Catamount Care or VHAP. How will that shake out legislatively? I have no idea. Will CMS be able to, will the state of Vermont be able to get the waiver from CMS to be able to administer that? Who knows? CMS has a lot of requirements that you have to abide by before they're going to say, sure, here's your money that it costs you every year to cover your senior citizens. You go ahead and do with what you want to with it. I highly doubt that's ever going to happen, just because of what the Medicare program was designed to do. It was designed to protect senior citizens with a specified list of healthcare services available to them. So I doubt you're going to see changes to any of that. It's merely going to be shuffling around who pays who holds the pot of money, and where does it ultimately end up. What you will see changes in, however, are supplemental plans and advantage plans. And what do those look like? I couldn't tell you right now. AARP is one of our most common supplemental plans that we have out there. Seems to be doing fairly well for everyone. They keep dropping them. Advantage plans aren't so popular here because we don't have a provider network. AARP just dropped 2 advantage plans last year. So they're no longer available this year. So advantage plans may change. Green Mountain Care Board might get really creative and create a new advantage plan that we haven't seen yet. We have no idea what that will look like, Will supplemental plans change? They might. You might now get your supplemental insurance through Green Mountain Care Board under a single payer system where they pay your 20%, your co-pays and your prescription drug costs, and you only are going through one system in the state. That's it, and then the feds. Other changes that might occur, I can't speak to, but I can tell you pretty definitively that there are no services that will change when single payer takes over Medicare, because Medicare itself has stipulated what it has to cover. Now, scams. We have durable medical equipment scams, where right now, actually actively in Wilmington, we have PME Health Services, Premier Medical Equipment Health Services, company out of Costa Rica, or San Juan, Puerto Rico, I'm sorry. Shut down a year ago by the feds. Showed back up in May in Wilmington, selling back braces to people that are ineffective. So state FBI group up in Burlington is on it. They know about it. We've sent out the alert for it. But that kind of a scam will continue. As long as you want to order a back brace, they're going to continue to solicit you for a back brace. Auto refills. One of the biggest scams that I have seen happen in a long time. Durable or auto refills for diabetic supplies. Every 90 days you receive a new kit of diabetic testing strips and whatever other equipment you might need. You don't use 90 days worth of that material. You only use 30. So now you've got 60 days in boxes tucked away in a closet that you're not going to use. And every single month you get that same shipment. Well, scam artists have figured out that if they give you a call and say, hey, that $36 box of test strips, I'll give you 8 if you sell it back to me. You're making a choice in a limited income between groceries and meds, and you might get $8 a box for those extra test strips. What are you going to do? So as long as those kind of opportunities for scams still exist, those scams are going to still exist, and I don't think single payer will do anything to stop that. So the demand of the scam has to stop, and the awareness of people being scammed has to become a little bit better before I think the scams will actually stop. And maybe under single payer, it might get better. There might be some more oversight of those programs, but I don't know that there could be any more oversight in those programs than CMS already does pretty regularly for their programs. So, like I said, the slicker the scam artists get, the more we've got to step up our game to figure out what it is that they're doing. Some of the services on the MSN are duplicated, so they would like to know why those services are duplicated and repeated over and over again, and are they being charged over and over again. The answer is, if it says that it has been denied, it was a multiple submission, possibly through an appeal, because many services, you send in a submission for it, or the insurance company or the provider does, it's denied, and they have to submit multiple times to make sure that those services get covered. It's one of the ways the scooter store gets through and gets that $50,000 scooter approved. So as long as it says denied at the end of those duplicate services, I wouldn't worry about it, because it may have just been a multiple submission on a statement or a billing issue. But if it's been paid more than once, and you are showing that you have to pay out of pocket more than once for that same service, that's when I would question whether or not it's a fraud or error. And what are the best resources out there for Part D and Part B information? Number one is going to be your SHIP coordinator. So sitting down with Sharon and looking at the different plans and using the comparison tool for those different plans is going to be your number one best defense for dealing with that. Number two is going to Medicare.gov and doing the comparison yourself. And what you do is you enter in your scripts, and it will bring up 3 different plans to compare with to see what your monthly cost will be. If you auto refill, some pharmacies have a special program where if you only get your pharmaceutical through Walmart, then you get a deeper discount on those pharmaceuticals in addition to what your Part D gives you. So,
What if you've never used pharmaceuticals, but you're old?
If you do not take prescriptions and you need to get a Part D,
Well, I don't know that I need to, but it seems like everybody does it, so.
No.
Everybody does it, okay.
cautiously, the best advice I can give you for if you don't know if you need it and you don't take pharmaceuticals is the same issue we have with Medicare Advantage plans right now. Is that initially when you are first 65 or first joining, you might be healthy, you might not have prescription drugs, you might not have to go to the doctor very often. Initially, the costs out of pocket are not going to be much. So some plans, people are getting away with $30 a month on an Advantage plan and they have no other health care costs whatsoever. But you get upwards of 75, 80, those Advantage plans can actually charge you more according to your age, and your out-of-pocket expenses will become more.
As you get older, or?
Yes, as you get older. So it's up to you to make that choice, and that is that choice to be made for yourself is, am I healthy enough that I'm not going to need original Medicare right now? I can stick with an Advantage. My out-of-pocket costs are going to be much less right now than they will be when I'm 75. Is that going to make more sense to me than going right on an original Medicare, paying my $104 a month, paying my $140 a year, paying my $30 a month for my Part D, and just being covered and knowing that I have that protection?
What about B?
B is the $104 a month premium for Part B, which is your provider services. And provider really is very important. If you don't have another type of, A is hospitalization. Did you
A
want
and
to?
B are automatic.
B is not automatic.
That's what I was asking.
B is the 10% penalty if you do not enroll at the age of 65.
Right. So the best resource for making.
Is working with your SHIP coordinator.
Okay,
She's got the most information, they've got the most up-to-date information. In most states, SHIP and SMP are the same person. Here in Vermont, we are not. So I work very closely with them. They spread my message, I spread their message, so kind of works hand in hand together, so.
Okay, thank you.
All right, thank you for having me today.